Welcome to our webinar on Towards Healthy Outcomes for Individuals with FASD, presented by Dr. Jacqueline Pai. My name is Malou Gabert, and I'm a bilingual project assistant at Health Nexus. So, Health Nexus oversees several provincial initiatives related to FASD. We allocate subsidies every year to 40+ support groups for individuals with FASD and their families. We design an online training for service providers from various sectors, including healthcare and nursing, education, mental health and addictions, justice and corrections, and community and social work. Lastly, we manage the FASD provincial website, fasdinfotsaf.ca, where you can find recent and up-to-date information about what's happening, learn more about resources and tools, and find out services available in your local community. So a few house rules. During the presentation, you may be tempted to ask questions about yourself or loved ones with FASD. Please do not use any identifying information to protect people's privacy. By law, we have a duty to report to Children's Aid Society or the police any threat to a child or direct attempts to harm yourself or someone else. Presenters cannot provide clinical advice, and this would require professional counseling and more in-depth knowledge of the situation and behaviors at stake. Today's discussion provides information about latest research, evidence-based practice, or general education tips and advice. If you need ongoing support, please consider connecting with your local FASD worker or join one of our Health Nexus support group for individuals with FASD and their families. You can find this information on our website, fasdinfotsaf.ca. Before we start the presentation, I would like to begin by acknowledging the Indigenous peoples of all the lands that we are on today. While we meet today on a virtual platform, I would like to take a moment to acknowledge the importance of the lands which we call home. We do this to reaffirm our commitment and responsibility in improving relationships between nations and to improving our own understanding of local Indigenous peoples and their cultures. From coast to coast to coast, we acknowledge the ancestral and unceded territory of the Inuit, Métis, and First Nations people that call this land home. Please join me in a moment of reflection to acknowledge the harms and mistakes of the past and to consider how we are and can each in our own way try to move forward in a spirit of reconciliation and collaboration. Today, we're welcoming Dr. Jacqueline Pai. So Jacqueline Pai, is a professor at the Department of Education, Psychology, and assistant clinical professor in the Department of Pediatrics at the University of Alberta. Dr. Pai began her career as a criminologist and forensic counselor working with incarcerated youth. Motivated by this early work, she returned to academia to study youth at risk, child development, and neuropsychology. Now, as a researcher and a practicing registered psychologist for the past 20 years, her research focus includes identification and evaluation of interventions to support healthy outcomes for youth put at risk, and in particular, individuals with fetal alcohol spectrum disorders. Dr. Pai has over 100 peer-reviewed publications and reports, but places the greatest value on her work with various community and government agencies. To this end, Dr. Pai currently leads the Intervention Network Action Team and is Senior Research Lead for the Canada FASD Research Network, roles that facilitate the link between research, policy, and practice. We're thrilled to listen to their presentation. Please ask your question in the Q&A. I'll provide more information and links in the chat. Now, I'm going to hand it over to Dr. Pai.
So thank you, everybody, for having me here this morning and for joining me for a bit of a conversation about FASD and healthy outcomes today. I'm really excited to be here and hopefully present a little bit, almost of a sampler platter. Really, I share this framework with you and a number of resources that come along with this framework, or the kinds of things that we're kind of hanging on the framework, and also the philosophy that lives behind the framework and has driven it, and the rationale for why we even have it. So that's my hope for today. Before we get started, I just want to say I appreciate the land acknowledgement that was already presented, and am thankful for that opening. And just want to note that I'm joining you all here from close to Edmonton in Alberta, and that's Treaty 6 territory, and traditional lands of the First Nation and Métis people from these communities. And not only acknowledge sort of my appreciation for the fact that these lands were first held by these communities and these peoples, but also the ongoing relationship that is so valuable to the work that we do, and my gratitude for the learning opportunities I've had working with the Indigenous communities in our region. I've learned so much. And so not only am I appreciative of the land and the territory I get to reside on, but the fact that the cultural learnings and experiences I've had have taught me so much about what I understand about myself, my research, and FASD in terms of how we work with people and how we conceptualize outcomes and trajectories and ways forward. So I feel so much of my work has been deepened, and I feel that I just continue to grow, and so that gratitude I hold, I just wanted to share with you all. So anyway, thank you for that. So now I'm going to jump right in, and what I want to start with is just a little bit of a review of what are we talking about when we say FASD. I always like to make sure we all start on the same page, and so there's a couple of key points I'm going to make, and then we're going to jump into the framework, and I'll give you a little bit of backstory around it, the philosophy, the components, and even some of the research that we're doing with it right now. And we'll hopefully get that all done in the next 45 minutes or so. And then I'll be really excited to receive some questions, because I feel that's the opportunity for us to kind of focus it and make sure that the content presented is really relevant and meaningful for everybody. So add those questions. I appreciate that. So getting us started, what is FASD? Just again, to be on the same page. First thing is in Canada, FASD is a diagnostic term. We use that term to describe the impacts of prenatal alcohol exposure on the brain and body of individuals. We understand that prenatal alcohol exposure impacts individuals such that they will experience some kind of challenge in their daily living and will require support to reach their full potential. We also acknowledge that it's a spectrum. Therefore, everyone with FASD is unique. And I will highlight this, and you'll hear a lot of it today. They have areas of both strength as well as challenge. We speak a lot about challenges often. I want to bring those strengths alongside and elevate them, because they're particularly relevant when we're talking about intervention and planning forward. A few more details about FASD. What are some of the common areas of difficulty? Well, there's many, and it can be incredibly diverse. I list a few here, things like motor skills and how individuals move and navigate their physical world, their physical health and body-based functioning, their ability to learn and remember things, their attention span, communication, how they receive information and share information, how they regulate emotions, how they manage strong emotions or even just day-to-day emotions and stresses, how they interact socially, build relationships, and move forward. Ultimately, we're dealing with individuals whose brains have developed uniquely. And so their experience of interacting with the world will be unique, and that can affect so many different skill sets. And yet alongside the areas of difficulty, as I've already noted, are areas of strength. And that's the aspect of FASD that gets really exciting for me, as we have the opportunity to increasingly acknowledge those strengths and recognize that that's part of what not only makes individuals with FASD unique, but so incredibly valuable, and their contributions to our world and our functioning so meaningful. And that's such an important and central message within our healthy outcomes framework. We also understand that the physical and mental health needs of individuals with FASD are complex. This means that individuals with FASD will often intersect many of our systems of support in terms of things like healthcare. There an estimated 90% of individuals with FASD will present with some kind of mental health need. That can include things like depression, anxiety, attention deficit hyperactivity disorder, a number of different things. This means that in addition to those brain-based differences in, say, motor control and learning, there may also be mental health needs. Physical health needs are also reported, and in fact, over 400 different health conditions have been identified for individuals with FASD. This may include things like difficulties with spinal cord and their spinal structure, increased rates of things like scoliosis, arthritis and other pain conditions that come on earlier and present at younger ages. Some of this becomes particularly interesting when we think about how we provide support and provide support early. And when we think about interventions and the reasons for having a framework and a structure to think about intervention, what we're doing is sort of elevating some of these needs, not to say this is the central story, but to say when we recognize that there are some of these high needs early on for individuals with FASD, we can proactively and preventively get supports in place so that we can mitigate the impact. Ideally, with those elevated supports, we may actually see a reduction in mental health needs, or we may see mental health needs that are better managed at an earlier stage and therefore less disruptive to an individual's life. So while we identify these numbers, it's not to say these are inevitabilities or mean that adversity is necessarily the trajectory, but rather these are some things that we can be aware of so we can be proactive and intentional in the support we provide. And that's just me kind of already starting to plug the importance of a framework and a bit of a roadmap for how we provide support across the lifespan. We also understand that individuals with FASD have reported higher rates of early life adversity and adverse outcomes. And that's important to acknowledge because it means that with that understanding and that shared knowledge base, we can go forward differently and we can start thinking about how we can leverage systems of support to reduce those adversity experiences. How prevalent is FASD? Well, it's quite significant, and it's something that we're increasingly gathering information around. We don't have great prevalence estimates in Canada, so we do have estimates, and right now we're talking about 4% of people in Canada have FASD, which is really a significant figure. This means there's 1.5 million people in Canada currently with FASD, or 1 in 25. These are really high numbers. And if you want some context, I put them here next to just other conditions that we might be more used to hearing about. So if you think about 4% and you go, wow, that's closer to ADHD than some of these other developmental disorders, mental health needs, or physical health issues. You see how prevalent it is in our communities, and recognize that having an integrated response to how we support individuals with FASD is so critical. This is a very prevalent need, and there are a large number of individuals who can truly benefit and experience success within a context of support. A final thing I want to say about FASD and what causes FASD, because this is one of the challenging aspects, as FASD is often accompanied by a high level of stigma. That stigma is sometimes associated with those individuals who may have consumed alcohol during pregnancy, the individual with FASD themselves, or even caregivers of individuals with FASD. And it's difficult to unpack that, and there's been currently a lot of research looking into it. But one of the things that we certainly have been saying really strongly is that, alcohol is an equal opportunity teratogen. Anyone who consumes alcohol, teratogen is, an agent that crosses the placental barrier and does have an impact on development in utero. It absolutely does. However, the conditions and the factors that may contribute to alcohol consumption are really complex and diverse. And we need to appreciate that there are multiple risk factors, and that approaching support for FASD, whether in a preventative or an intervention or any other capacity that you might be intersecting, requires a supportive, non-judgmental, and non-stigmatizing response. what we need to be doing is wrapping ourselves around individuals, communities, caregivers, parents, and all spaces as it associates to FASD, and thinking about support and prevention in a very non-judgmental and supportive way. It's just a uniquely complex issue that, like I say, intersects with a lot of different social issues and challenges that we experience. And so I just like to, it's a bit of a soapbox. You can probably hear me. I'm trying to rein myself in right now, but it is, whenever I talk about FASD, something I really like to put out there is to remind us that a supportive lens and approach will take us a lot further and helps us to share responsibility for all those people in our communities and think about how we're caring for each other as opposed to judging each other. So I'll just throw that out there, and if there's some questions about these aspects, I'm happy to think about that at the end. But now I want to turn our attention really fully towards the framework. Now that we have a little bit of a shared sense of what is FASD, let's think about a framework. And first off, why is the framework important? Why are we even talking about it? And there's a few reasons. Probably way more than I've put here, but I've put a few just for us to think about. One is about shared understanding. It's really important that when we're providing support, thinking about intervention, planning forward, that we have a bit of a shared understanding. And a shared understanding can look like a lot of different things. But the two that I want to highlight is philosophy and goal setting. Philosophy means, what is our belief and our thinking around what intervention can look like, what individuals with FASD are capable of, what communities of support can be. Philosophy really matters. It ties into our basic beliefs and thinking. And as we go forward, I'm going to unpack that element a little bit and share what are some of the core sort of philosophy elements that we have implemented within this framework, and a little bit on the rationale for some of those. And the other aspect is that we need a shared understanding of goals. We need to know where we're going. And if we're going to have any ability to build a plan together, to think about how we might get there. And I'll emphasize, and yes, this bleeds into philosophy. I have a hard time separating that, but this really allows us to start thinking about goals as not just about challenges to be mitigated. You're going to hear this a bit from me today, but also to really think about, where are we going to go? What does success look like? What could that pathway be? How can we get there? And so shifting away from simply resolving challenges or saying, how do we kind of get through now, to setting genuine, authentic goals for an individual that help us raise some expectations in an appropriate and healthy and respectful way in pursuit of those healthy outcomes. So a framework gives us a space for that and allows us to set those goals up and to share that in a consistent fashion across systems of support and involved individuals. It allows us to be more intentional in the way that we pursue those goals, so that it's not just accidental development, but actually really proactive and intentional pursuit of these specific goals. We can also use a framework to streamline some of the links between research and practice. We're often saying, gosh, research is really slow, communities work faster, but even when the research does come along with some good ideas or insights or things that can contribute to the way in which we're conducting practice or engaging in our day-to-day activities, sometimes we're really slow to get it out, and it doesn't mobilize well into communities. But a framework provides us a mechanism where we can populate that framework over time, increasingly with all of the emerging research. So we're more rapidly able to create those links and make that information accessible. And it goes the other way as well, because once we have a framework and we're starting to set goals and we're working closely with community to think about how we're navigating those pathways towards healthy outcomes, we may also engage in more research to say, wait a minute, here's some gaps. Here's some things that we weren't asking question about. And so the communication can also flow more readily between individuals in research spaces, practice spaces, caregivers, policymakers, wherever we're at, so that we can start to integrate our efforts and all pull in the same direction under that same philosophy umbrella that allows us to work together. That integrated approach, shared kind of direction is really where momentum comes from, and allows us to not feel as though we're constantly needing to convince people, bring people on board, say this is what we're doing and why, but rather we can then focus on the actual how do we get towards our goals, because the rest of that framework is set up and shared for all of us to access. So those are some of the reasons behind why do we even do this? What's the point? So how did we do it? Now you're saying, well, what did we do? Well, this has been an iterative process and will continue to be. So we work in a circle, around we go, and we'll keep going around and round. And the kinds of things that we're doing is, as we work on this framework, and oh, spoiler alert, I will on occasion note today that we're talking today about the Towards Healthy Outcomes original framework. This is the original version. However, we've been currently working on the 2.0 version. So in the next few months, definitely within 2023, I had to think about what year we're in, you will see THO 2.0 released. And so I'll make some reference to that as we go forward. But again, we're continuing to circle around. This is the process we take. We review the literature. We stay tuned into what is the current best evidence for practice that we can pull from and make sure is integrated into our framework. We think about the core themes and ideas, because we recognize that FASD does present in unique ways for different individuals at different ages and different stages. However, even so, when we look into intervention research and the data available to us, and including the lived expertise that we increasingly draw on, we recognize that there are sometimes some core themes that we can pull from and that we can integrate into the systems of support that are being provided. So we can still be both unique and responsive to individual needs, while at the same time employing some systematic approaches to doing business that are evidence informed and allow for the most desired outcomes to emerge. We really wanted and continue to think about what development looks like, and lean into just human development when we think about this framework, because we want to emphasize that individuals with FASD still develop through human stages. I mean, we're people first, right? We're all people first. And so when we want to think about intervention frameworks, and we want to think about how do we support people towards healthy goals, we're thinking about how do we foster healthy development? How do we support development? And that's not just supporting areas of need, that's supporting healthy development. And so we want to make sure that through our framework that we're highlighting just what are areas of healthy development, so that we don't miss opportunities for intervention in our effort to mitigate challenges. We want all the opportunities. And as I talk about some of the domains, I'll highlight a couple of spaces where this has become particularly salient for us, as we've said, oh, wait, when we take a developmental lens, there's a few extra things that become important to us as we think about intervention. And of course, we've done a lot of community consultation. We are so fortunate to have a lot of really invested community members, families, caregivers, service providers, you name it. And some of you may even be here today. If you are, you maybe recognize, yeah, I've been involved in this, Jackie. Let's see how well you present it. But really, that has been fundamental, because we can talk a lot about the evidence, but until we really understand from community voices and spaces how that's effectively enacted within community, it becomes really difficult to think about how we can create a meaningful framework. So these things have all continued to work together and have never stopped. So the circle is ongoing and continuous. Probably if I were to add another, spot into this, and maybe I will going forward, is that we're also now doing a lot of direct research with the THO framework itself. So we're actually saying, how do we action this framework? What does it look like to make it more than just a framework, but actually a tool, a resource? Ooh, that next step. And so that's something that we've just started doing in the last year or so. And I'm going to give you guys just a little bit of insight into a couple of projects where we're doing that now, and really thinking about that next stage for this framework is how it can be operationalized in different ways. All right. So let's talk about the framework. Where are we at? What does it look like? Here it is. If you haven't seen it before, this is it. And I know you'll be provided with a link to the actual framework itself. So you can have a look at it and read through the document if you feel like you want to. There'll be a lot more detail in the document than I'm covering today. Of course, today is just a bit of an overview. And as I already said, and you'll get tired of it, but I'll be shameless in my plugging it. 2.0 will have a few changes in terms of the structure and the domains a little bit, but we'll hopefully draw out some of the elements of the framework that we've heard back from community have been particularly valuable and useful. So there won't be major changes, but there will be a few noteworthy ones. So let's talk about the philosophy behind it first and unpack some of the thinking that went behind this framework. And then we're going to walk through each of these domains very briefly, because there's a lot of them. And as you can imagine, we could spend a lot of time on any one of them. But I want to just sort of introduce a little bit of how they're set up. And I also hope to share a little bit of the resources that are available within some of these domains, just to kind of give you a sense of what's there and something that you can look at and follow up on in your own time after this. So first of all, the name itself, healthy outcomes, reflects a real philosophy and reflects that we are emphasizing healthy living and quality of life, not solely remediation of deficits. Now, this is not an either or story. I want to emphasize that we're not ignoring or saying, let's not talk about challenges or let's not pretend they're not there. Rather, we simply want to elevate our focus towards healthy outcomes, which means that we are addressing areas of need while also nurturing, fostering, supporting areas of strength and really balancing that storyline. We also see this as a way to, as I've already talked about, facilitate setting expectations and goal setting, as well as being a real growth framework. So it's a framework that constantly says, how are we moving forward? How are we growing? And how are we doing it together? As you'll see, as I keep talking, I emphasize that a growth framework means that we as a community can grow and learn, and individuals with FASD can grow and learn. We as a community can contribute to these healthy outcomes, but individuals with FASD also contribute to their own healthy outcomes as well as our healthy outcomes. So there's a real interaction there. As I support somebody with FASD towards their healthy outcomes, you know what? There's a two-way street, because I experience real positive and meaningful interactions, which promote my well-being and move me forward. So this growth framework really creates space where there is mutual benefit and mutual support experienced. And that creates space for purpose, that creates space for hopefulness, and for even creativity, because when we're starting to ask questions like how, and we think we have a little bit of hope, okay, yeah, we can achieve some goals. They've got to be reasonable. They've got to be the right goal. Sometimes we've got to change goals, but when we believe that goals are possible and we start to think about how we get there, we're hopeful, we're creative, we're persistent, we're motivated to get on board, be part of that team and work together. And that includes all of us, including individuals with FASD. And I really want to emphasize that they are equitable partners in the journey towards healthy outcomes. So what other guiding philosophies underlie this? And there will be some shifts in these a little bit in 2.0, but the spirit of these are not going to change. We've employed a developmental lifespan perspective. This means we're thinking about development. As I've already talked about, we're really focused on human development, as that really relates to what it means to achieve goals beyond simply looking at areas of need, and also emphasizing lifespan. We talk about strength-based and empowered, interactive, and central to this all, we create this tenet of all behavior is functional. Well, I sometimes get people looking at me a little funny when I say that, but let me unpack these. All behavior is functional. Essentially, this is working with the idea of functional in terms of utilitarian. So behavior is meeting a need of some kind. It doesn't mean that it's intentional. It doesn't mean that it's planned. It doesn't mean that somebody can even articulate how it's meeting a need. Sometimes it's a body-based need. Sometimes it's a brain-based need. If I'm overwhelmed and my system's shutting down, I'm going to respond in a certain way. I'm going to handle that stress. And sometimes my body is going to do it for me because it needs to let off pressure. It needs to respond to some kind of circumstance or something that's going on for me. The reason we frame it this way, or the reason we feel it's important to highlight the functional or utilitarian nature of behavior as a central tenet, is that when we do that, we can start thinking about, what do I know instead of what do I do? Because if we step back and stop saying, first, I need to know what's that intervention. And we say, no, first we actually have to understand a little bit more about what we know. What is the context? What might the need be that's being met? We might start evaluating other ways that that goal or that need might be met. Because if our intervention, if we've made an assumption as what the need is and we're wrong, then we can intervene, for a long time. We can try lots of different things, but we're not necessarily going to see our intended outcome because we're not actually addressing the need that's being met. Maybe we're trying to suppress something, which is really hard because needs find a way of emerging, or we're misunderstanding. So for example, if we have a child who's moving around a lot in the classroom and we go, oh, they're clearly very hyperactive, let's get strategies for hyperactivity. But in fact, this child is moving a lot because they have a lot of pain, and the way their spine is developed or the way their hips are nesting, it's created pain, and sitting is actually hard and difficult. So they move a lot because it hurts to sit. Then our intervention will not be appropriate if we're looking at that need as hyperactivity and the need to move, as opposed to the need to manage that pain or to find something that's comfortable. So that's just an example of how, if we can back it up and think about those needs, we can start to ask, okay, what do I know? Because then I can think, how do I find a pathway towards that, a goal that we're trying to achieve, which may be sitting or just experiencing some success in the classroom. So if my goal is success in the classroom, then I might say, oh, some of the barriers might include my pain experiences or these things. Okay, now we can think about how to work past those to achieve that goal of success in the classroom. What do I know? Helps me think, how do I get there? Developmental lifespan, as I talked about earlier, it takes that developmental framework, recognizes that FASD is lifespan. FASD does not go away. Individuals may experience a lot of success and meaning and purpose in their life. Absolutely. That can look very different for different people because this is a very diverse population. But even within success and goal attainment, this doesn't mean that they're not experiencing FASD. It means they found the right fit to achieve their goals, meet expectations, grow and develop as an individual with FASD. So that lifespan element is really important. It clearly has significant implications for how our systems of support are structured, because it requires integrated support across the lifespan, not integrated support that stops at the age of majority at 18 or 21 or something like that. So that's, sort of the policy implication and the service delivery implication of taking a developmental lifespan perspective. Another element of it that is always important to me is it also acknowledges the fact that in our development, wherever we sit in our development, all of these arms are relevant. Or somebody has once told me that it looks like ribs and a backbone, and I'm like, oh, that's a really interesting perception of the framework. I didn't think of that when we put it together, but I see it now. So the ribs, if we want to call it that, are relevant at all stages, believe it or not. Where you are in a moment in time, whether you're in that teen stage or transitioning adult stage or younger or older, you are a product of past experience. So what are the things that have happened to me, current decision making, as well as future goals and where I'm going. So how I respond in a given day is going to relate to those experiences of the past, as well as my prospective experiences. How I imagine my future looking is actually relevant today. If I see a future, if I don't see a future, it's relevant today, just as relevant as looking backwards. I noted earlier about that there is higher levels of adversity for individuals with FASD, and that is something that's particularly relevant when we take into consideration this lifespan perspective, because adversity experiences can have a significant impact through the lifespan. We have identified for individuals with FASD an elevated rate of early life adversity. In a study that we did with a pediatric group, and I think the average age of this group was about 9, so they're a young group, we found an average number of adverse childhood experiences to be 3.4. This is a really high number when we look at adverse childhood experiences. Most folks may have 0 or 1. Once we get above 3 and into these kinds of ranges, we're looking at folks that often experience a lot of related or associated difficulties later in their life due to some of these adverse experiences. This is certainly likely the case for individuals with FASD who we understand have particularly sensitive stress response systems. So exposure to elevated rates of adversity, so more stress for somebody who's more sensitive to stress, can really combine to create a high level of vulnerability. I say that, but perhaps just because it's me, the other side of the coin is that same vulnerability that means that adversity can have a significant impact and can be very relevant throughout the lifespan as we think about how we support people has big implications for intervention, because we know that individuals with FASD are also highly responsive to relational systems of support. And so when relationships can be incorporated and in place early on in life, and then throughout the lifespan, wrapping around and engaging and including and empowering individuals with FASD and making sure that we work from a shared understanding, we see improved outcomes, we see some success. So those early life experiences and the ways that they translate through the lifespan and can be considered within an intervention framework can look at things like relational sources of support. What's a vulnerability is also a strength. That stress response system or that sensitivity can also be very, very receptive to support. I don't talk about it here, but I can't help but mention that some of the work we've done has also highlighted the fact that resiliency factors for individuals with FASD have really looked at connection and relational resources as one of the most noteworthy resiliency resources for individuals with FASD. So really thinking about that within our framework becomes relevant and important, and how that's woven throughout the framework matters in that developmental approach. Okay, the next one. So I don't get caught in that. I got to keep myself moving, otherwise I get excited and we'll get stuck in something. Is we try to emphasize the importance of interactive systems. And again, this is a framework that's intended to facilitate communication, shared understanding, and effective movement between systems so that we can all be on the same page. Structure, consistency, and fluid support makes an enormous difference. I'm sure if there are caregivers out there, they'll be able to say that when we all pull together, outcomes are drastically improved relative to when we're all working towards different goals or different ways or in different understandings. It's really problematic when people are not on the same page. And so how we intersect with systems really matters. Influences of systems can be both additive and interactive. So if we can really work together, pull together, and build some beautifully effective dynamic teams when we have that shared purpose and understanding. We've produced a couple of materials that may be of interest related to this philosophy and this idea that incorporate some of the evidence available. We have a paper here that I just refer to, and sometimes I pop papers up and they will be with your handouts when you get them so that you guys can take a look and follow up on these things. I've tried to leave as many seeds in this presentation for follow-up for all of you if you're interested. But this is really asserting what an integrative systems approach needs to look like, how that has to happen. And in the best practice toolkit that we have also put together, and that's available on the CanFASD, Canada FASD Research Network website. We talk about some of the ways in which some of these integrated practices might be operationalized within systems of support, what it can look like at a policy level through to a practice level and a client level, and how we can become better at integrating sort of our systems and services through all of those levels. So these might be some resources and things that you might want to have a look at if you're interested in how do we work together to better integrate services at a high level. Finally, I want to just refer to again the strengths-based and empowered. You've heard me talk about both of these things a little bit already this morning. This is really important to elevating the space and the place of the individual. Individuals with FASD are at the center of their life, just as they are at the center of the model. Of course they are, it's their life. And so giving them ownership over their life, recognizing that they need to have some control and some empowerment and decision-making and space where they see purpose and meaning, their own contribution and their own opportunities for growth is really, really important. It doesn't mean that that operates in isolation and that operates without supports. Mind you, I would offer that many of us don't do what we do, don't live in the spaces that we live in without some kind of system support wrapping around us as well. So individuals with FASD are no different and just may simply need greater levels of support in different spaces and places in their life so that they can have the right kind of fit to experience the success that they're very capable of in their lives. So that's something we really emphasize. Co-creating success is something that we speak to, and we found a lot about in some of the research that we've conducted, recognizing that as we try to imagine how do we achieve a goal, how do we work towards a solution, what might success look like, engaging individuals in developmentally appropriate ways in kind of constructing those solutions, figuring out what strategies might work, thinking about what might be an effective course is really important to do. In many cases, due to the prenatal alcohol exposure, their brain is going to function a little bit differently than ours is. They're seeing the world, interpreting the world, and responding to the world in their unique way. This means that their expertise about themselves is critical for us to think about how we go forward. Thinking of ways to engage them in this solution-seeking process can be really valuable because oftentimes they will generate solutions or approaches that are like, oh, I never thought of that. I wouldn't have commented that way, but all right, let's try that. Interestingly, when we did that, and in this study, we talk a little bit about how we did that and how that came about. But we found that the strategies that were developed were actually generalized far better as well. So they were able to use at home or at school or in the community because it was their strategy. It made sense as opposed to trying to take my strategy and use it where I would sometimes see it as long as I was around to remind them, but it never became a naturally occurring or generalized strategy. When we did some co-creation, we saw much greater success in that regard. The other paper that's noted here is just some of the research that we've been doing lately to really capture and identify some of the strengths that individuals with FASD present with. This is one of a few papers that have been coming out lately to really highlight what strengths we're identifying, and also to say to researchers, we need to do more to identify what strengths individuals with FASD have, what we can be doing to nourish and build and foster those strengths. And a lot of that is actually that interactive piece, because we've heard from a lot of caregivers that are like, we're tired of all the deficit stuff you guys talk about. Can you tell us about the strengths? We need, like, we see all these great things in our kiddos and our young adults and the people we work with. We see some amazing things. Why do we never hear about that from you guys? And that was like, oh, yeah, all right, that's one, thank you. And it's really sparked a whole lot of new and important research that has become very central to the backbone. We keep using that metaphor now, so thanks to the folks that pointed that out, but that backbone of the framework as we've gone forward. So here we are back to the framework. So I've shared with you some of the philosophy, and I'm hoping that as I've shared with you some of the research that has contributed to the development of that philosophy and the ways in which we see that philosophy is important in shaping our beliefs and our thinking, you can kind of see why we've really wanted to nest the framework in that, because some of those philosophy pieces are the most important points of shared understanding, the points that if we can be on the same page in terms of collectively seeking understanding of an expressed behavioral need for example, in order to identify a solution, we're in a very different place than if we're simply saying, how do we eliminate a problem behavior? It's a really different way of having a conversation. Some people say it's just flipping the coin, but it's definitely a different approach. And so that's just a critical piece of how we go forward. So I now want to very briefly, I'm going to take us on a quick tour through these domains. This is going to go fast because I don't want to spend too much time in any of them. I'd rather direct you to the framework itself for some reading, but I just want to highlight some of the resources that are available so that if, depending on where you're from or what areas you're in or kids that you're supporting, different stages, it may highlight a resource that you might be particularly interested in taking a closer look at this time. The first domain that we highlight is that of physical health. This is a domain where we're recognizing the physical health needs of individuals, which can include some of these things that I've referred to already, sort of like early presenting needs like arthritis and trying to have pediatricians, for instance, on board to understand that we might be asking them to investigate physical needs even at an age much earlier than would typically be done. Physical health also includes medication use and how we are really conscientious in our use of medication and thoughtful in terms of decision making. Dr. Mansfield Mella has produced for us a medication algorithm that is resourced here that has been a real support to many families and physicians as they seek to think about the appropriate use of medication for individuals with FASD. Other resources that we link to in our guide and will certainly in 2.0 as we go forward is some of the work done around sleep and responding to sleep needs. Dr. Anna Hanlon-Dearman has done some really remarkable work around sleep interventions and how we can support healthy sleep in individuals with FASD. So if those are some things you're interested in, you'll find some links to that in our document. Attachment is another area. I've spoken to this a bit already when I've talked about relational sources of support and adverse childhood experiences, because attachment is often the thing that is most affected and also leveraged when we think of both sides of that coin related to adversity. We know that stable home placements and healthy attachment is critical for everyone, all of us. Having that secure attachment experience can make a real difference to how we go forward in our lives and explore new experiences and engage in future relationships. This is something that we have seen intervention around attachment to provide support with parents seeking to attach in healthy ways to a child with FASD, acknowledging that sometimes attachment looks a little different for this population who might interpret, say, serve and return responses a little bit differently than we might expect. But interpreting different is not the same as not interpreting, meaning individuals with FASD can attach and in fact attach very, very well and can be incredibly relational. Sometimes it's just a matter of understanding how that works and what that looks like. This associates closely with family cohesion, in which we're highlighting the importance of stability and long-term supports that are not changing. Dr. Dorothy Baddery has done a lot of work around this. A lot of it is focused on the child welfare system and how we provide stable and supportive environments within that system for individuals with FASD. But Dr. Baddery's also worked a lot with caregivers and thought about those environments, caregivers, be it adoptive caregivers or foster caregivers. So even outside of the actual system, she's worked with the individuals, and you see the I Am a Caregiver resource that I referenced there, that if you haven't seen it already, you might find really interesting and might find that it provides some important links to resources for you. And a spoiler alert on those two. In the 2.0, those two, the attachment and family cohesion, you're going to see as a more integrated domain. There won't be two anymore. There'll be one that's integrated and really highlighting some of these elements of relationship. And the research has really brought those together and helped us kind of delineate some of the nuggets of knowledge that comes from relational supports and early attachment experiences, but lifelong attachment experiences as well. So you'll see that in the 2.0, but you will definitely still get a lot of great resources in the current version. Social functioning is also identified. as such an important part of experiences, meeting individuals, building relationships, and moving forward in your life. We can imagine this has implications for educational success, employment success, community success, is how we begin to navigate our social worlds. And I've provided a link here to some resources. In all of these cases, it's exciting because there has been research conducted, and we've looked at things like, can we improve social functioning and support individuals with FASD in building their skill set around this? And the answer is yes, we can. And so when we have those shared goals, we work together, we adopt some of the philosophies, and we incorporate evidence-based interventions to support growth of these skills. The convergence of this evidence with these shared philosophies and belief systems really situates us in a space that we see the best impact, maybe the best bang for our buck is a way of putting it. We have lots of information around education and possible supports that can support educational success for individuals with FASD. Sometimes the educational environment can be particularly challenging because there's a lot of different things that are going on, be it those social skills development, academic development. There can be high levels of stress and the need to manage so many competing demands in that setting. And so there similarly have been a lot of resources produced for education. Some are geared towards how do we support academic growth, literacy growth, math growth. Yes, we can, and there are some interesting supports available around that, to how can we create relational supports within school settings that help to create shared understanding and help to navigate some of the complexities of the school environment in a successful way. And when we do that well, we see kids feeling positive in school, experiencing success in school, and staying in school and graduating from school. So getting to that space will require a lot of communication and shared understanding, but we know that it's possible. And there are definitely some great resources telling us a little bit about those success experiences as well as things we can learn. We have an online course available through the CanFASD website for educators in particular that walks through a number of these evidence-based approaches that they might be interested in, as well as some current strategies in this document. So feel free to have a look at some of the things that are available for educators if you're interested. Identity development is another domain, and this is actually one of the domains that I alluded to earlier when I talked about something that we hadn't had on the radar until we worked with community, and they said, wait a minute, healthy development involves developing a sense of self and identity and who am I? So wow, yes, it's not something we often talk about when we're thinking about, intervention or assessment or how we're providing support. And yet understanding identity and how individuals see themselves, whether it's an adolescent who's trying to become more independent and saying, wait a minute, I don't understand how I'm fitting here, helping them actually to explicitly pursue this, who am I and where do I fit and who can I talk to and where is there support for me to make sense of my unique self really matters. How do I understand my diagnosis, what that means for me, how much of me that is, and how central to my identity that's going to be as important work. I don't have specific resources here, but they're coming. And in fact, there's a few studies underway right now where we're seeking to better understand this and to provide some support and suggestions going forward in this area. Mental health and regulation is an area where we spend a lot of time talking about needs of individuals, and I've already referred to this a few times in this presentation today. I want to highlight that there are resources available to help us support individuals in terms of mental health across the lifespan and emotional regulation. You'll see some mental health resources, as well as some specific resources that have been put together recently. So for example, sometimes when we struggle with mental health and regulation needs, we see experiences of substance use or even justice involvement and those kinds of outcomes. And yet we're also building supports to say, even when we're intersecting with those systems, we can do so in an FASD informed way and experience success. So you'll see here, I've linked to our treatment guide for substance use treatment providers in terms of what it means to be FASD informed. We also have justice resources and things like that on our CanFASD website if you're interested. More mental health resources are coming. Presently, there's some work being done to build a mental health toolkit for mental health providers. So stay tuned and watch for that. It's coming. Community engagement is important, how I see myself in my space. Here's a resource that talks about what it means to support success for adults in their community activities. Going forward in 2.0, that community engagement will be blended with the adaptive skills domain. So again, this is another domain integration you can watch for 2.0, where we're going to actually reframe it as looking towards interdependency, acknowledging that individuals with FASD will be working towards interdependency, to what extent they are autonomous and to what levels they need support in being autonomous is unique for each person. But at the end of the day, it's not about independence and it's not about dependence. It's about the middle ground where there's an intersection between that individual and their support network as we work together towards those healthy outcomes with that active engagement of the individual in their adaptive and community functioning. Housing is a basic need, and we recognize that sometimes housing is an area of challenge for our population. If you take a look at this resource we have available, again, we're working, looking at how we can create shared understanding for our housing providers so that we can be all on the same page as we work towards successful housing maintenance for individuals with FASD. So if you're in the housing stage or place, have a look at this framework. There's more coming in terms of housing and accessible housing resources and tools over the next year. So this is a good start, and watch for more resources coming. Employment, similarly, employment that is purposeful and meaningful is really important. Here's a resource I link to that also can support employment folks around how do we facilitate employment experiences that are successful for individuals with FASD. So again, just highlighting the resource, have a look if this is an area of particular interest for you. Parenting, I don't have any resources linked here, but we do in the healthy outcomes, we do mention a few opportunities, and I think more resources are coming here in terms of how interdependency models can help us create opportunities for success for individuals with FASD in their parenting. So that's the framework in a nutshell. And I know that's a lot of information, but like I said, it's to kind of give you things to go forward. And I'm just going to spend the last couple of minutes we have together here before questions, putting on your radar a couple of intervention framework research projects we have ongoing, so you can sort of see where we're looking to operationalize this framework moving into the future. The first is a CanFASD project, which has a mouthful of a name, which is why we call it CanFASD, but essentially it's a client-oriented mapping system. So how do we take the healthy outcomes framework and actually link it to assessment and diagnostic clinics so that we can facilitate communication, advocacy, connection, and recommendation development using the THO framework. So that if you go to a report and you get an assessment, you can receive an adjunct report at that time within a healthy outcomes framework that identifies some of the recommendations that help you to communicate and advocate around this model. So in other words, we want to action the model with specific recommendations for individuals at a clinic level. So this is something we're working with clinics to develop. We've incorporated a whole lot of different things, including our national FASD database. Thanks so much, Dr. Jocelyn Cook, for the amazing work she's done on that database. Our healthy outcomes model you've seen here, clinical practices in the many participating clinics, and of course, families. We couldn't do it without you. To say, how can this adjunct report be a useful mobilization of the healthy outcomes framework using clinic information and data? So we've been working for the last, spring 2021, it tells you we've been working on this a little while. We're looking towards piloting this over the next year, and hopefully we'll have this really available to clinics within the next year or so. So we're really excited to see this. Similarly, we're working with families to say, can we also take healthy outcomes and put it into a training format? So we can use it to deliver interventions at a clinic using the CanFASD. It can help map right from the clinic, but can we also use it as a tool for training and even planning at a caregiver level? And so we've been working with a caregiver program in terms of saying, all right, let's put towards healthy outcomes into training modules. Let's do some surveys ahead of time. Let's do some surveys afterwards. And then let's work with these families to say what elements or what additions can we make to the model, to this framework that would help operationalize it in your day-to-day activities. Like, what are the things that you as a family might find useful? So first off, going through the training, going through the modules, we've heard lots of really positive outcome. I put these in the other order. I'm going to start with the resources here, actually. Sorry about that. And then I'll tell you about the impact of the training. So in working with these families, the resource and the thing that they've said would be particularly helpful is around goal setting. They're like, can we sort of build a map? Can we build just like a template for how we set goals, who we talk to, so that when I go in and talk to the physician, I can have a piece of paper that we can write a goal down on. Like I want something tangible, or I want something on my phone that I can write this goal down. We can write out the next steps, and we can put some people's names down and make them accountable. Like, we want to actually get more tangible and intentional about our goals. We're like, super idea. So we're working with these families to do that and build this alongside of these domains. And now the impacts of the training is that we found that certainly caregivers are already big believers in their child's ability to grow, in their child's contribution to their own growth. However, even those big believers, after the training, their belief in that growth and the potential to work towards solutions with the individual in their care grew. And that's what we like to see is when we can do training that can have people feel that they have more capacity to do so. The other side that we were really happy to see is that folks who felt like there was a lot of apprehension and anxiety associated with their caregiving role felt that they felt less of that. Some of those fears were really managed and supported through working through this program. And that's really exciting, because the more we can support our caregivers, they are a critical resource. I mean, I hate saying that about caregivers, you're a resource, but it's true. Central to how we create success in networks. And so the more we can do to support our caregivers, the better. Caregivers had a lot to say as well in terms of our transition to that interdependence domain that I've identified, where we're merging those in 2.0. And just to read a couple of quotes, because I love the voices of caregivers. With accommodations, right support, our kids do grow in different ways and at a different pace. None of it looks the same. Growth is not overarching in every way. Growth may be able to handle a specific task better than they did previously. Sometimes we need to look really hard for growth and wait a long time. But in all of these cases, they're highlighting that potential for growth and movement towards those healthy outcomes. They also feel that FASD is different diagnosis, that everybody is unique. And so their plans and the way we set goals and work towards healthy outcomes needs to be unique. And having the shared philosophy, but the flexibility in our framework is really important. As we continue to work forward with the towards healthy outcomes, we want to continue to increase accessibility to facilitate communication, planning, and integration of services. So we're really looking at not only how do we get our resources more accessible, but how do we look at platforms and approaches to distributing the framework that increasingly elevate its accessibility. We're really excited about what the future holds. And as you probably have noticed, I'm also really excited about the continuing updates and adaptation to the healthy outcomes model and our 2.0 that's going to be released in this year. So really excited about how we've been able to evolve it. As I wrap up, I just want to offer my thank you and my gratitude to the individuals with FASD and their families who have been so central to all of the work we've done. Intervention work is not possible without individuals with FASD and their families, and their support and expertise and contributions are absolutely central to everything that I do, and I offer just tremendous appreciation to them. Similarly, I really appreciate community members and frontline service providers, educators, whose courage to try new things have really created some windows of opportunity. Having somebody come in and say, hey, can we think about this totally different? Is sometimes a lot to hear. And yet there's been folks who are like, all right, let's just revisit this. Let's rejig this. And gosh, that opens doors to really wonderful ways of thinking and being. So thanks to those folks who have been part of the research and done that. Of course, I also have to thank the tremendous research team that I have the opportunity of working with. There's just so many brilliant researchers and students that I get to work with that make such a difference. And the money people, thank you for funding support, very important. And thank you to all of you for being here today, joining me in this conversation. I look forward to hopefully hearing back from you, either questions today. Certainly feel free to shoot me an email. Feedback and thoughts are always welcome. We're on this journey together. We get better together, and having the opportunity to connect and intersect and interact with all of you is just one of the things I love most. So thank you very much. And I'm going to stop sharing and get us to questions.
There's a question that's also kind of a comment saying at the beginning of the presentation, considering how difficult diagnosis is to reach, the 4% is more than likely an underestimation regarding the 4% of the population.
Yeah, that's a wonderful question. And certainly that's been suggested, is that, in Canada, we still haven't got diagnostic services, equitably accessible across the country. And so that is an estimate, and it's an estimate that does include a bit of extrapolation based on what we do know in some regions. But I would agree, I think a lot of folks believe that that could be an underestimate. Time will tell, and as we get better at measuring it, I hope we have a lot more confidence around the number. Either way, it's definitely something that says, boy, we need to attend to this.
Another question that we received was, when trying to meet a goal with an individual, could our art therapy or art-related therapy be a useful therapeutic technique? I don't know if you have any.
Yeah, I mean, I think anything can be a useful technique. I don't mean to sound really vague with that, but I really do. And because I think it relates to, is this well suited to the individual? What's the goal in terms of your therapeutic goals that you're seeking to pursue? And then, of course, we monitor how we're pursuing the goal. And if we're like, okay, we're not quite getting where we thought we were going, or the journey isn't getting us towards that goal, because goals are nice markers, then we can adapt. But yeah, sometimes art and art-related approaches can be so much less threatening and can be amazing ways of expressing for a lot of people. So I think that can be a fabulous approach when it's the right fit for individuals, and when we see that it's actually helping us work towards the shared goals that we've identified. So yeah, thanks for that question.
Thank you. Another question was how to explain what is addiction to teens and young children, and if you have any resource recommendation on the topic.
I don't. You know what? I'm pretty sure I've seen some. Gosh, I'm almost thinking on the SUAP website, there might be some information about talking to kids about addiction. And sometimes there are some programs that provide a little bit. That's a really excellent question. And I don't have anything at my fingertips, but I would be surprised not. And if that individual wants to shoot me an email, I can also kind of take a look around. But I would think looking at, the SUAP website might be the place to start for that kind of process.
Thank you. Another question we received was, so many Ontario-funded FASD supports are only for children and youth with FASD and their families. How can we use your lifespan recommendations to advocate for lifespan provincially funded supports?
Oh, that's a great question. And it's a how question. I really like how questions. But how you use it, I think can look like different things, but that is our hope, is that it does support your advocacy initiatives to say this has to be lifespan, including, and even the paper and that we've produced around integrating services. We're trying to put these things out so that we actually have a tangible in writing, something that you can bring to people. I certainly know sometimes when working, and I am not a government expert. Anyone, you guys, those of you who I know, who I see some familiar names and things come up here, that's not necessarily my superpower. But one of the things I do understand is that if you can share some of these resources, find a bit of a champion, then they feel like there's something that has teeth. Like, here's the evidence, here's the resource. There's something in writing that says this is how we need to do business. And so sometimes I find that I've heard from folks that can be a real communication tool. I know that in some communities, New Brunswick, for instance, they've actually built the Towards Healthy Outcomes into some of their actual kind of policy and into their FASD strategy. As a way to kind of anchor it and say, here's the evidence, here's the resource. So we're not just making this stuff up. Like this is the evidence-informed recommendation. So Nancy, I don't know if that was really a direct answer, more of a wraparound. I feel like that's a great how question that could be a nice opportunity for a roundtable brainstorm. But certainly we're doing our best to produce the resources that perhaps can come to the table with you to support those advocacy initiatives.
Thank you. Someone else asked, how often would you recommend a neuropsych be done? FASD assessment had to be done before 7, but how different is a child brain to a pubescent brain? Sorry.
Yeah, no, that's a great question. Certainly through development, brains do change considerably. Oftentimes in an assessment, you may see a recommendation. So sometimes your clinicians will say, based on this unique child or the context, I'd recommend an assessment in this many years. I generally say 2 to 3 years, depending on what resources are available, and at the very least, prior to transitions. So for instance, if you had somebody who was diagnosed in preschool, definitely before they enter a middle school or any kind of secondary school, having something done to help inform the support when they're transitioning into a new school environment or a new context. And then again, an assessment prior to transitioning into adult services can be really important because brains do develop uniquely and differently. And it's very difficult to kind of plot a trajectory for an individual with FASD. We're finding that those assessments are not revealing typical trajectories when we're doing them. So definitely before transition, depending on funding and resource availability, 2 to 3 years is a really nice time span, but that is often not viable.
Mm-hmm. I'm going to take the time for one last question before we wrap it up, because I do have just one more slide to go through. So the last question I'm going to take is, do you have a beta version of CanFASD?
Yes. No, Karen, we don't yet. But we're actually just working with the programs right now to produce it. And then we'll be working with clinics so we have a number of partnering clinics working with us right now on Compass, and they will be beta testing it with us, hopefully over the summer, knock on wood. So it's coming, and it's something that, like I said, will be distributed through diagnostic and assessment clinics. So if that's of something of more interest to you, feel free to reach out to me on the side, and I can give you an idea of the trajectory, and we can talk about your interest for sure.
I'm going to wrap it up, and thank you all again for listening. If you have any questions, you can always reach the FASD team at Health Nexus at FASD support at healthnexus.ca. Thank you again to Dr. Pai for this presentation. That was very informative. Take care, everyone, and stay tuned for more webinars by Health Nexus.
Thank you all so very much. Take care.